Are you a new parent looking for guidance on bottle feeding your little one? In this video, I will share the best tips and tricks for keeping your newborn safe while bottle feeding. 1. What are the safety guidelines for bottle feeding a newborn? When bottle feeding a newborn, it is important to take the following safety guidelines into consideration. Ensure that bottles and nipples are properly sterilized before each use. Never prop the bottle when feeding, or leave your baby alone with a bottle. Be sure not to overheat formula or breast milk during the warming process. Make sure bottles, nipples, and lids fit together correctly. Avoid using any cracked or damaged bottles. Discard unfinished feeds after 2 hours of preparation, as bacteria may form in stored milk formula after this time period. 2. How often should I feed my baby with a bottle? It is recommended to feed your baby every 2 to 3 hours, or 8 to 12 times per day. This will vary depending on the age of your child and their individual needs. Make sure you are following the instructions provided by your pediatrician and/or other healthcare provider. If you're having difficulty keeping track of how often you should be feeding your baby, set a timer or alarm to remind yourself when it's time for another feeding session. 3. Are there any special considerations for sterilizing my baby's bottles? Yes, there are. All bottles should be sterilized before each use, whether they are new or have been used previously. This helps to ensure that your baby's bottle is free from bacteria and other germs that could lead to infection. Most bottles can be sterilized using boiling water for around 5 minutes, but it's important to check the manufacturer's instructions first, as some may require special attention. If you are using a microwave bottle sterilizer, follow the directions provided by the manufacturer carefully. This will help ensure that all of the germs on the bottle have been eliminated safely. Additionally, make sure to clean all parts of your baby's bottle thoroughly with hot soapy water after every use. 4. What is the best way to hold the bottle when feeding a baby? It is important to hold the bottle correctly when feeding a baby. The most comfortable and safe way to hold the bottle is with your dominant hand, keeping your fingers below the teat of the bottle and supporting it near the base. This will help you maintain control over how quickly or slowly your baby drinks. Make sure that you keep the baby upright while they are drinking. This can help reduce their swallowing and colic symptoms. Additionally, avoid propping up a bottle in order for your baby to feed themselves, as this can increase their risk of choking or aspiration issues. 5. Is it safe to prop up a bottle while feeding my infant? No. It is not safe to prop up a bottle while feeding your infant. Propping up a bottle could cause choking or aspiration, which can cause serious injury or even death. Additionally, propping up a bottle may lead to overfeeding, as your baby will continue to suck on the nipple until all of the milk is gone if they are not monitored closely. It's best to hold your baby and feed them from the bottle instead of propping it up. 6. How can I tell when my baby is full from drinking from their bottle? When your baby is full, it will usually stop drinking or slow down its rate of drinking from the bottle. They may let go of the nipple and turn away from it. Or if you hold them up in a reclining position and take the bottle away, they won't reach for it. It's important to pay attention and not overfeed your baby, as this can lead to stomach upset and other issues. If you're unsure about how much milk your baby needs at each feeding, consult with your pediatrician for more specific advice. 7. Are there any tips or tricks for burping babies after they finish their bottles? Burping a baby after bottle feeding is important for helping them release gas and avoid tummy discomfort. With newborns, the best technique is usually to keep the baby upright against your shoulder and gently pat their back with your hand. You can also try sitting them on your lap facing away from you and lightly patting or rubbing their back. For older babies, you may want to try cradling them in one arm while supporting their chin with your other hand, then patting or rubbing their back until they burp. Experiment with different techniques and find what works best for you and your baby. We hope this video has given you some helpful tips on bottle feeding your newborn safely. Remember to always follow the manufacturer's instructions when preparing and administering formula or breast milk, as well as washing bottles and teats thoroughly before each feed. If you have any questions about bottle feeding, consult with a healthcare professional for advice tailored to your baby's specific needs. Don't forget to comment below if you have more tips or experiences that may help other parents. And don't forget to subscribe so that you can stay up to date on all our latest videos. Thanks for watching.